Hello everyone, I'm Dr. Lim Chin Tat. I'm a private orthopedic surgeon as well as the medical director for the orthopedic practice and surgery. Thank you once again for tuning into this channel. Today I'll share with you on ways to prevent sports injuries. We will start by identifying the intrinsic as well as extrinsic risk factor for sports injuries, and then I will go through with you the measures to prevent sports injuries. If you have any questions or queries, please feel free to write them in the comment below. Thank you.
And I think to talk about prevention, we should target the why we talk about prevention is actually, in fact, in this period, COVID period, I've seen more and more knee injuries because individuals pick up new sports. Okay, so is it cycling? Because more people get on the bicycle. I mean, it's my own observation. It's not only my own observation, it's in a Straits Time, but I do see that there are more people cycling. And these people doesn't cycle short distance. They really cycle, and they prefer to cycle at night, and they can cycle 50 to 60 kilometers. Some of my patients, they will cycle like 2 rounds around Singapore. And I have a patient that's an ultra marathon runner. They run 322 kilometers. Okay. So people pick up new sports, they get injuries, and people ignore pain. Okay. Persistent pain, not the 2 weeks kind of pain, but persistent pain. Some of them want to avoid going to see a doctor because of a fear of contracting COVID, which I perfectly understand. So they want to avoid going to hospital, avoid seeing doctors. Okay. And some of the professional and semi-professionals are worried that the injury is the end of the road for them and they don't want to declare. Okay, so the problem builds up like that. So about prevention, I think most important, we talk about the risk factor for injuries. Then we'll address each of the risk factor. Okay, I'm starting with extrinsic factors. That means factors that is in the environment, outside of our body. Okay, I think it's important because it's a low-hanging fruit. You can change it easily. So environment. Why I bring up environment is because during this COVID period, I can see the change. Firstly, people are avoiding gym, or gym has been closed down. And many of my patients actually avoid gym even though it's open because closed door, mask down, they are not comfortable running with other strangers. So they actually move outdoor. Okay. And also day or night. So many of them switch to night. They actually exercise outdoor at night because they not used to the heat because they run in the gym in the aircon. And they also choose the night to avoid crowds, okay, so that they reduce the risk of getting COVID. So what this implication is that because they switch from indoor to outdoor, now there's a lot of uncontrolled variables such as the weather, the humidity, the heat, and it's very difficult for some of them to get used to it, especially for those that are deconditioned. And this could lead to injuries easily, okay? So, and even if you choose to run in the gym, the issue is that some of the gym may not be so well conditioned. I mean, it may not be well maintained. So you must also be careful when you run in the gym. And I like to show this picture because I was initially running in the gym. So when COVID strikes, I changed to outdoor. So I like this picture because you can see in this picture, there's a field terrain. There's a running track. Let's assume this is a running track. It looks like a running track. And this is a tarmac and this is a grassland. So when I first switched from a treadmill to a tarmac, I can feel the impact on my knee because the tarmac is really hard. So the joint reaction force, the joint, that the impact really goes to my knee. And I can actually feel it, and my running slow down. I feel a bit pain over the knees, and it just feels different. So you may want to choose a running track because the running track, after all, is soft or grass. Okay, and it's not easy to run in the grass. But if you choose a running track, just be wary. Not all the tracks are maintained in the same way. Let me look at the insert pictures over there. There are potholes everywhere in the running track. So there's something that is an extrinsic factors, and you should avoid it or be aware of it so that you know how to deal with it when you run around the track. Other factors, sports equipment. I mean, I'm not asking everybody to go and analyze the feet to get a custom-made shoes. I think a good pair of shoes with thick heel pad, with a good insole, depending on whether you're flat feet or high arch, something that can support the insole, a big enough toe box so that your toes doesn't squeeze inside, and you feel comfortable with wearing it, you should be fine. Okay. As for knee guard, I don't normally advocate wearing a knee guard because when you wear a knee guard, your muscle actually goes into hibernation because your body thinks that the knee is stable, so they're not working. But all in all, wearing a knee guard when you have pain, with some instability, I think is no harm, okay, but not for the long hours. And the last extrinsic factor is human factors. Okay, so these are the factors that's really difficult to control. It can only be controlled by choosing your opponent. I mean, weekend warriors, choose your friends to play with, or you can choose your sports that no contact, running, swimming, jogging. But if you really want to play contact sports, of course, contact sports, there's a higher risk for injuries. And it's something that you cannot change, but you can choose if you want to choose. Choose your friends. Is intrinsic factors. Age. Okay, young patient. Nowadays, people are going to competitive sport earlier and earlier. Okay, so they, as a primary school, they start training at high intensity, 10 hours, 12 hours. Okay, even though we are not talking about overusage today, we are talking about injuries. A lot of time they may present with pain. If they present with pain, a lot of time they may even attribute to growing pain and they continue to train. But the problem is that when they are still growing, it may affect their growth plates. So growth plates are present in individuals pre-puberty. So there is a growth center of the bone. So the bone get longer and longer, they grow. So you don't want to damage it by overusing it, overloading it. Okay, so it's important, especially for kids, maybe sometimes to take it easy and slow down a little bit if there's persistent pain. Another factor is gender. Again, this intrinsic factor you really cannot change, or it's difficult to change. Okay? Gender. So I choose an example how gender will affect the injury. So in this paper from America, it has shown that the female athletes are 2 to 8 times more likely than male athletes to get a anterior cruciate ligament injury. This is very well proven that females get more ligament injury for many factors that we shall go through later. One of the factors is they have wider pelvis. So they have, if you look at my marker, they have wider pelvis. So the knee tends to point inwards and the knee tends to collapse inwards when you load it, when you run, and when you don't pay attention, you run that way and it's going to collapse and the anterior cruciate ligament is going to tear. This is very well proven and we do have a program to educate them and condition them. So general health and physical fitness, of course, they are important intrinsic factors. For a patient with less endurance, they tend to get injury at the end of the exercise regime. Okay, so it's important to step up slowly. Okay, so these are the factors that can be changed, that can be improved, and it takes time. Body composition. I mean, a bigger size, imagine a bigger size individual, when they twist the knee, the forces over the knee will also be much higher. Okay, so the body composition is important and the skill level. I mean, higher skill professional athletes, they generally have very good response time and they know how to cope with sudden and unexpected circumstances. Okay, so these are the intrinsic factors. Some can be changed, some cannot be changed, but we'll deal with it as it comes. So this is something important, stretching. I'm sure it's very common and everybody, I believe most of us will do some stretching before we exercise. Okay, those with the physical education, when we attend class, we always stretch before we start class. And those who have done national surveys will do a lot of stretching before we start class. Ignore this chart, very complex. So just think of two things, static stretching and dynamic stretching. Okay, this is very important. So what is static stretching and what is dynamic stretching? So static stretching, I think, is the one that most of us do. Example, stretching the muscle. Example, just holding and stretching the tricep. You just hold it there and stretch out the muscle. So this is static stretching. You don't move. You stretch out and hold the muscle there for a few minutes to stretch out the muscle. Dynamic stretching example. So you move. Is very dynamic. Example, if you are going running, you run on the spot for 2 to 3 minutes. That's dynamic stretching. So you don't really hold the muscle, but you reproduce the action in a slower, lower intensity. So that's dynamic stretching. So it has been shown that static stretching affects performance. Okay, so we generally advise patients to do static stretching after training because we don't want the muscle to stretch out, because the muscle has an ideal length. The length actually affects the muscle, and the proprioception, that means the balance of the muscle, is affected by the length. So if the muscle is stretched out, they may not be able to balance so well. So you do it after to prevent muscle ache later. But you should do some dynamic stretching before. So like I said, if you're going to do a bicep curl, instead of immediately grabbing a 10 kg load and doing bicep curl, you can do it like that for 1 minute just to reproduce the action and to stretch out the muscle, but stretch out the muscle and to warm up the muscle, not to stretch out the muscle. So this is dynamic stretching on the left and static stretching on the right. Okay, so I hope that because I think many of my patients will tell me when I ask them whether they stretch, they will tell me all about static stretching, stretch the quads, stretch the bicep, everything. But dynamic stretching is the one that's important before training, and it can actually, in fact, increase the performance. Then we talk about special program. Okay, not many of us would actually enroll in a special program, but this is a paper from Australia. So is it going to be discrimination? Should we ask why should women and girls be playing football if they have increased risk of ACL ligament injuries? You're asking the wrong question, because we do know that what is wrong and why are they at risk, which I shall go through later. And there's actually a special program called the FIFA 11 Plus Injury Prevention. Okay, it's available online and it's free. It's a 20 minutes warm up. Okay, so most of us, I don't think we need to go through a 20 minutes, but it's something that is really, really useful. That's just one of the example on the body position when you jump, when you run. So in ladies, because of the wider pelvis, the knee tends to go inwards like an X shape, and that's not so good when they land, because the force will push the knee inwards and tear the ACL or the meniscus. So when we go through all this with the individuals, we always correct them, feedback, ask them to practice in front of a mirror or practice with a friend. So the key take-home message for prevention, I think first and foremost, address the extrinsic factors because it's easy. So selection of the sports or exercise that suits you, that fits you. If you want to play contact sports, just be ready for higher risk of injury. I mean, I've done ACL reconstruction, ankle reconstruction, and they are mostly for football, basketball. But badminton is one of the non-contact sports that's quite high risk of ligament injury because of the twist and turn and the high impact. And I choose the same environment. So if my patient is switching from a gym to an outdoor, I'll ask them to explore the running route first. Run through the route, walk through the route, and don't change. Don't change the route. I know some of us like to change just to make it more interesting. But if you're not ready, then don't change. If you're going to run at night, I always ask my patient to explore the environment in the daytime. Take note of the step, take note of the pothole, and then you can run at night if you want to. Okay. Intrinsic factor takes longer. That's why we deal with the extrinsic factor first. So conditioning, very important. As you get stronger, as you get fitter, as your endurance and strength increases, you respond better to unpredictable circumstances like a pothole. And very importantly, gradual step up intensity, okay, and frequency. So you can either step up by increasing the intensity, maintaining the frequency, or you can maintain the intensity and increase the frequency. Okay, but I think most of us like to keep the frequency and increase the intensity because of time constraint. Okay. And stretching, very important. Dynamic stretching pre. Just try it tomorrow. Okay, dynamic stretching pre and static stretching post. Okay, static stretching is still important. I think because at least for my reading and for my personal experience, static stretching does reduce the delay onset muscle soreness for me. So some people after exercise, they get this muscle soreness, not knee pain, but the muscle around the knee they get sore. But I think the stretching helps to reduce the incidence of a muscle ache. And of course, special program for those who have resources and for those who are really, really into exercise, you should get a special program, either see a physiotherapy or a personal trainer. Personal training is more for gym. I think that the gym is important. At least I've been telling my patient, at least just invest in the first few sessions for the personal trainer to look at your form, make sure everything is okay, and then you can do it on your own.